On February 12th, Wisconsin's Senate Health Committee spoke overwhelmingly in favor of a bill that would expand Medicaid coverage for new mothers. Currently, Wisconsin is one of only 2 states that has not expanded Medicaid coverage to a full year postpartum. Arkansas is the other state that has yet to make the expansion. Even states that did not adopt a full Affordable Care Act Medicaid expansion have expanded postpartum Medicaid, and that includes states like Florida, Texas, Georgia, and Kansas. In Wisconsin, women's coverage lasts only 60 days after the birth of a child, and we're showing you that map of the United States, Wisconsin and Arkansas, the 2 that have not expanded. Wisconsin's purple on this map. Wisconsin actually asked to expand Medicaid 90 days postpartum, but the federal government said that was not the intent of the change, that it was not long enough. It was the American Rescue Plan Act that first introduced the idea of expanding Medicaid postpartum. It was the Consolidated Appropriations Act that made that permanent. The purpose was to help improve maternal health and coverage stability and help address racial disparities in maternal health. In Wisconsin, generally, pregnant women are eligible for Badger Care Plus up to 306% of the federal poverty level. Parents and childless adults are only eligible for Badger Care up to 100% of the federal poverty level. So the change for pregnant women is 60 days postpartum, their financial eligibility drops from 306% FPL to 100% FPL, and a number of women therefore find themselves no longer eligible for Medicaid. And the impact is quite large. The State Department of Health Services tells us 1/3 of pregnancy-related deaths occur after the 60-day postpartum period, and 76% of those people who died had Medicaid at the time of delivery. Senate Bill 23 would extend Medicaid coverage for postpartum mothers from 60 days to a full year, and it has bipartisan support. In fact, it was co-authored by Republican Senator Jesse James, and he said, "My goal as a legislator is to make sure we keep moving Wisconsin forward and fight for the future of our youth. We as a state are unfortunately behind on this issue." And he said, "We have a choice to do better for our moms, our kiddos, and our families as a whole." So far, that bill has 23 Senate co-sponsors and 67 Assembly co-sponsors. So what's next? Governor Tony Evers has proposed expansion in each of his budget proposals since 2019. He is working on his budget draft right now. The legislature, however, has rejected it each time. Past bills have had support in the Senate and Assembly, but it has never come to a vote. Assembly Speaker Robin Vos has been a staunch opponent of the policy change and has so far blocked its passage. He also said a vote this time around would be unlikely. You can read more on the proposal to expand Medicaid coverage to postpartum. We link to resources in the description below.